Not every cancer treatment means sitting in a hospital chair with an IV. Today, more and more anti-cancer drugs are available as tablets or capsules, taken at home on the patient's own schedule. This shift brings a new level of convenience and freedom, but it also quietly transfers a lot of responsibility from the medical team to the patient. In this video, we'll explore what this change really means for patients, their families, and healthcare providers. Oral anti-cancer agents give patients the freedom to take their medication at home. There's no need to travel to an infusion center, no needles, and no hours lost sitting in a chair. This flexibility lets people fit treatment around their daily lives and avoid risks like infections from IV lines. For many, this improvement alone makes a real difference in their quality of life during cancer treatment. But with this convenience comes a trade-off. When patients take oral therapy at home, there's no healthcare professional watching every dose. There's no nurse to confirm the tablet was taken correctly or to catch a missed dose or dangerous interaction right away. The success of treatment now depends on what happens after the patient leaves the clinic. Adherence is critical with oral anti-cancer agents. It means taking the medication exactly as prescribed, the right dose at the right time for the full duration. Even small mistakes can matter because these drugs often have a narrow margin between an effective dose and a toxic one. Unlike many other medications, missing or delaying a dose can have serious consequences. Research shows that adherence rates for oral anti-cancer agents are often between 70 and 85%. That means a significant number of doses are missed, delayed, or taken incorrectly. Common reasons include side effects like nausea or pain, complex dosing schedules, unclear instructions, and simple forgetfulness. These challenges are real and affect many patients. How do patients struggle with adherence? Side effects can make it hard to keep taking a drug that feels worse before it helps. Complex regimens, different pills on different days with or without food add confusion. High costs can put some treatments out of reach. Sometimes patients simply weren't told clearly why adherence is so important, and sometimes it's just ordinary forgetfulness. Missing doses isn't just a small mistake. Suboptimal adherence can make treatment less effective. There's also a hidden risk. If the disease progresses, a doctor might think the drug itself failed and switch to another treatment that never got a fair chance. Non-adherence also leads to more doctor visits and hospitalizations, raising the overall cost of care. Adherence isn't the only challenge. Oral anti-cancer agents are especially prone to drug interactions, and because patients manage them at home, these interactions are easy to miss. Some interactions can make the drug too strong or too weak, affecting both safety and effectiveness. Understanding these risks is crucial for anyone taking oral cancer medications. One of the biggest interaction risks involves the liver enzyme CYP3A4, which metabolizes many oral anti-cancer drugs. Taking these drugs with a CYP3A4 inhibitor like grapefruit juice or certain antifungals can push drug levels too high. Taking them with a CYP3A4 inducer like St. John's Wort or some anticonvulsants can make drug levels too low, reducing effectiveness. Absorption matters too. Some oral anti-cancer agents need an acidic stomach to be absorbed properly. Common medications like antacids or proton pump inhibitors, often used for heartburn, can lower stomach acidity and reduce how much of the cancer drug is absorbed. This can make the treatment less effective even if every dose is taken on time. Some oral anti-cancer agents can affect the heart, prolonging the QT interval on an EKG. Combining them with other QT-prolonging drugs raises the risk of dangerous heart rhythms. Others can affect blood clotting, especially when taken with anticoagulants like warfarin, increasing the risk of bleeding. Even certain foods and herbal supplements can interact in these ways. All these risks point to one thing: patient counseling is essential with oral anti-cancer therapy. Good counseling protects patient safety, supports correct dosing, and directly improves adherence. It's not one size fits all. Education must be tailored to each patient's needs, health literacy, and learning style to be truly effective. Thorough counseling starts with the basics: the name of the medication, why it's prescribed, the exact dose, the schedule, and how long treatment will last. Patients need to know whether to take the drug with food or on an empty stomach and what to do if a dose is missed. These details help patients feel confident and prepared. Patients also need a clear picture of potential side effects, what to expect when they might appear, how to manage them at home, and when a symptom is serious enough to call the care team. This knowledge helps patients stay on track and avoid unnecessary worry or emergency visits. Counseling must also cover drug, food, and herbal interactions. Patients need to understand why it's so important to tell every healthcare provider about all medications, including over-the-counter drugs and supplements. This helps prevent dangerous interactions and keeps treatment safe and effective. Safe handling and storage instructions are important, too. Oral anti-cancer agents are often hazardous compounds, even at home. Patients need to know how to store their medication safely, keep it away from children and pets, and handle it properly to avoid accidental exposure. Throughout counseling, the message about adherence must be reinforced. Taking the medication exactly as prescribed is what makes the treatment work. Patients should be encouraged to use reminders, pill boxes, or other tools to help them stay on track and avoid missed doses. Patients need a clear, simple answer to one question: who do I call if something goes wrong? Every patient starting an oral anti-cancer agent should leave with straightforward contact information for their oncology team. This ensures that questions or concerning symptoms never turn into missed appointments or unnecessary emergency room visits. Oral anti-cancer agents represent real progress in cancer care. They offer more convenience, more autonomy, and treatment that fits into a patient's actual life. But this progress only pays off when patients are supported to manage their treatment safely and effectively at home. The pill itself is only half of the treatment. The education behind it is the other half. Thorough counseling, clear communication, and ongoing support are what turn a convenient pill into a truly effective cancer therapy. Patients and providers must work together to make oral anti-cancer therapy a success. Summary: oral anti-cancer agents have transformed cancer treatment, offering patients more freedom and flexibility. But with that freedom comes responsibility, adherence, awareness of interactions, and the need for thorough counseling. When patients are well informed and supported, these medications can deliver their full promise, helping people live better, safer lives during cancer therapy.